first Australian conference.
Thank you. So yeah, sorry about that, everyone. We got our IT issues sorted. So just like to say hello and thanks to ASCA for inviting me to be a part of this inaugural sickle cell disease conference in Australia. And I'd just like to say that I'm presenting from Melbourne and would like to acknowledge the Boonwurrung and Wurundjeri peoples of the Eastern Kulin Nation as traditional owners and custodians of the land upon which I stand today. And I pay my respects to the elders past, present and emerging. So my talk today, I'll be giving a perspective as a nurse caring for children and young people living with sickle cell disease in Australia, focusing on our healthcare team here, the sickle cell population at the Royal Children's Hospital, the challenges in the Australian healthcare setting, the therapies we offer, nursing considerations that are specific to paediatrics, the benefits of dedicated local champions and what we can do to improve the care and optimise the healthcare of our patients, that our patients and families receive. So who are we? So at the Royal Children's Hospital in Melbourne, we're a specialist tertiary hospital delivering a full range of clinical services for the children of Victoria and also Tasmania and other states, as well as internationally. We don't have a dedicated haematology inpatient ward here, and so patients are cared for across the hospital in various departments and wards, the day medical unit and apheresis service, as well as many outpatient services. It's a picture of some of our lovely team, and we're made up of consultant haematologists, including our sickle cell clinical lead, Dr. Anthea Greenway, a clinical nurse consultant, an apheresis fellow who's involved in care of our patients undergoing apheresis or red cell exchange and in our outpatient clinic, the haematology fellows and registrars, and apheresis and day medical nursing staff. So the comprehensive care and surveillance needed for this population involves input from many care providers, from medical, surgical, nursing, allied health and administration staff, teachers, researchers, and of course, the children with sickle cell disease, their families and advocacy groups such as ASCA. So the sickle cell clinical nurse consultant, that's me. I've worked at the hospital since 2010 and began working in this dedicated sickle nursing role when it was first established in 2019. I work across multiple departments, haematology and day medical unit, seeing outpatients in clinic with the medical team, in inpatient wards or the emergency department, and performing red cell exchange in the apheresis unit. So my role provides a link between children and their families and the hospital to improve access to timely care and liaise with specialists on behalf of our cohort. I provide education to patients and families and also the broader medical, nursing and allied health teams that are involved in the care of our patients and consult with the healthcare teams around Victoria and interstate. I'm also involved in research with our campus partner, the Murdoch Children's Research Institute. So just a little look at our population here in Victoria and of course beyond. So at the Royal Children's Hospital, we have 60 current patients. They range from infants who are diagnosed at birth through to our 18-year-olds. We've got 33 female and 27 male patients. And while most of our families live across the northern and western suburbs of Melbourne, we have 5 families in regional Victoria, 4 in Tasmania and 2 in the Northern Territory. So these families who aren't near the hospital are cared for with local healthcare providers in consultation with the team here at RCH. So compared to many other paediatric hospitals around the world, this is a small cohort, but it's definitely an increasing cohort. In 2009, there were 37 children with sickle cell disease, and today we have our 60. So this really highlights the need for an expanding workforce of specialists with an increased knowledge of sickle cell disease. Some of the challenges we face here in Australia. So firstly, the exact incidence of people living with sickle cell disease and sickle cell trait is unknown. The hemoglobinopathy registry aims to collect this information and create a national database. And this will, of course, improve our knowledge of the prevalence of sickle cell disease and the scope of complications and treatments that are accessed across Australia. And having this information will help direct the resources which will benefit patients and families. So in Australia, particularly, sickle cell disease is a rare disease, meaning there's limited knowledge in the primary healthcare setting across emergency departments and other healthcare settings outside of the medical teams and nurses with this specialist knowledge. So this places a burden on patients and their caregivers living with chronic disease, and this is of course amplified due to the limited awareness of the disease. And there's certainly an identified need for education and advocacy. So in Australia, we don't have any routine screening for sickle cell disease at birth. So if parents are known to be carriers and the healthcare team are aware to perform antenatal screening, that can happen. But even then, there's a possibility of having a baby with sickle cell disease, and this isn't always identified before or during pregnancy. So if parents unknowingly have sickle trait and subsequently have a baby who's diagnosed with sickle cell disease, the diagnosis can come as a big shock, in addition to having a child who's presented to hospital quite unwell. So without early detection, there can be a delay in treatment and of course early intervention and mitigating some complications of sickle cell disease. But if the chance of having a baby with sickle cell disease is known, we as healthcare providers are equipped to provide antenatal testing and support to our families and genetic counselling, which can improve health outcomes by introducing medication, surveillance and monitoring for symptoms, which can start early in a baby's life. Another challenge with the sickle population in Australia is genetic diversity, which of course impacts those requiring blood transfusions. And there's a need for more donors from different backgrounds. So it's necessary to create awareness among the community of the importance of blood donation. So here's just an overview of the therapies across our cohort at the Royal Children's Hospital. We have over 66% of our patients taking hydroxyurea in addition to amoxicillin. 14 patients are treated just with daily antibiotic prophylaxis. We have 7 patients having regular red cell exchange, and they range from 7 to 18 years old. 2 patients have undergone bone marrow transplantation, and at the moment there's just 2 patients who are currently not on any treatment. So the barriers to treatment, to effective treatment are many, and of course compliance is up there. It's difficult to remember to take medication every day. I think we all acknowledge that. And also daily monitoring of symptoms can be tedious, and it's not always immediately recognisable as a symptom of sickle cell disease until the condition or the symptoms are worse. As our smaller patients grow bigger, the daily dose of hydroxyurea changes, and with that comes the need for more frequent blood tests, which is a big challenge for many children and their families. There's hesitancy to start on medication therapy, and this is a big consideration for a lot of families. So we can start the discussions early and utilise blood tests and imaging results and worsening symptoms or frequency of coming to hospital as an incentive to start on treatment. And navigating through an unfamiliar healthcare service is what is sometimes a new country, and with a language barrier, this can be extremely daunting and decrease engagement with the health services. So as many of our patients and families have backgrounds outside of Australia, family and social supports can be limited. And so having healthcare champions and advocacy groups is of the utmost importance to make people feel comfortable accessing healthcare. So our role as nurses is to provide high quality healthcare, and in the paediatric setting, it's really imperative to deliver care that's age and developmentally appropriate for the maximum benefit. So our cohort come from diverse backgrounds, and so an awareness from us of cultural and religious beliefs is really important in developing and maintaining good relationships with our patients and families. And the care we provide has to be tailored to the needs of the individual and be dynamic along with their changing needs as they grow. For blood tests, cannulas, immunisations, and lots of our procedures that can be distressing, we use sedation if this is needed, but also non-pharmacological distractions such as music and books, toys, iPad, sometimes hypnosis, and of course our excellent joke telling and stories is utilised. So we provide family-centred care, which takes into consideration the conflicting medical appointments and work schedules of our families, and being as flexible as possible to accommodate this, with priority of appointments and scheduling given to older children who are doing their final years of school. So we advocate for our patients within the healthcare setting, but also within their own family, within schools and the wider community. So just looking at our population sort of across the different age groups, in infancy, symptoms don't often appear in very young babies, and the first presentation to hospital can be a really confronting experience for the caregiver, especially if they're also facing a new diagnosis. As the specialist nurse, I aim to provide initial and ongoing education to help family learn to navigate their way through the healthcare system. There'll be many new faces and departments, an abundance of information, and of course lots of questions. But as treatment becomes part of life, it's important to know that we're here to provide that ongoing support. The aim is to provide positive experiences from early on, and while it's difficult to explain to babies the importance of blood tests, there's measures to make it a more pleasant experience for both the child and their caregiver. And this can hopefully set up lifelong positive relationships between child, family and the healthcare providers, which will ultimately lead to improved health outcomes. So in the early childhood years, in some cases, living with a chronic disease has become a part of life, or perhaps for the children who are diagnosed later, the patient and family are going through that process of adjustment. So the onset of symptoms might be occurring and daily medication is introduced along with these regular blood tests and other surveillance. So again, providing that ongoing support and education about sickle cell disease, its complications and treatment remains really important. So at this time, we engage in communication with schools, kindergartens and childcare, providing that general medical advice and recommended first aid treatment so that children can be safe and participate in school activities, knowing they are in good hands and in the care of someone who knows what to do if they become unwell. Around a third of children with sickle cell disease can have learning difficulties. So we aim to identify any issues with learning early on so that intervention and extra educational support can be provided if necessary. We encourage our children to participate in school and activities as much as possible, school camps and sleepovers, and this is with the aim of maintaining a healthy lifestyle, good social connections and achieving optimal growth and development. So as our young people hit adolescence, this is often a time of difficulty in anyone's life. And for adolescents with sickle cell disease, they're also dealing with a chronic lifelong illness that has limited treatment options and for many, no cure. Being a rare disease, there can be feelings of loneliness and that the disease is not widely understood. It isn't unusual to feel a lack of control over their life, with their self-esteem and mental well-being being impacted. So the role of social workers, mental health clinicians and psychologists has never been more important, and that's even more pertinent in today's world of uncertainty. So compliance with medication can be reduced as the teenage patient is encouraged to sort of take more control of their healthcare as they prepare for that transition to the adult healthcare service. Our wonderful teachers here at the hospital Education Institute can help to maintain communication with schools, providing support to Year 11 and 12 students completing necessary documentation for special considerations when undertaking exams and applying for university. And as with many adolescents, this can be a time of engaging in risk-taking behaviours and facing peer pressure. So for our older patients, we offer that option to talk with the doctor or nurse about sometimes difficult topics, talking about sexual and reproductive health, the risks of smoking, drug and alcohol use, and how these might affect their sickle cell disease. So it's really important to know the risks and in this way feel empowered to say no to friends. Also, during this time of a global pandemic, we're working really hard to encourage our young people over the age of 12 to be vaccinated against COVID-19. Unlike many healthcare services who treat people with sickle cell disease across their whole life, as a paediatric hospital, our patients have to transition to adult services. This is a time that's widely acknowledged to be associated with increased risk of a deterioration in health. So prior to transition, we take necessary steps to ensure our patients are equipped with the skills of communication, decision-making, assertiveness and self-care, the self-determination and self-advocacy to succeed in the adult healthcare service. And so we stress that things will be different in adult land and must help our young people to live well and achieve all their goals, regardless of their condition. So going to university, if that's their wish, getting a job, having a family. And throughout this time of transition, it's important to support the entire family, as this is, of course, an adjustment for everyone. So having caregivers with specialist knowledge and an interest in sickle cell disease is really important and beneficial. For children and their families, having that trusted point of contact to help navigate through a sometimes daunting healthcare service during what can be a really frightening time in their lives has the potential to have a positive influence on their ongoing healthcare. Knowing there's people who do understand their rare disease, who can provide that emotional support, education and encouragement is hopefully reassuring and comforting when experiencing symptoms or needing to come to hospital. So acknowledge that coming to hospital for appointments or coming to the emergency department and getting admitted can be a hugely confronting and distressing time. So as a nurse with a special interest in care of patients and families with sickle cell disease, it's my aim to make the interactions within the hospital and the healthcare setting to be more positive for children and their families so that they can feel safe and empowered. So while we as local champions caring for children and young people with sickle cell disease and their families strive for excellence, there's always room to learn, to adapt and to improve. Continuing education is imperative for patients and families, and really importantly in Australia with our growing sickle cell population, to continue that education of all the healthcare providers. So children can be involved in decisions relating to their care and treatment from a young age, and this can hopefully help with compliance and optimise health outcomes down the track. I would encourage all our patients at the Royal Children's to sign up to the My RCH portal, and this can provide access to medical records, results and appointments. It's really important to acknowledge that there are challenges of living with sickle cell disease in Australia and to provide the tools to help. So improved access to mental health services is something that's been identified as of the utmost importance by our families and patients, and we endeavour to improve the access to these services at the hospital and also in the community. And so while there's always more work to be done, our dedicated sickle cell service here at RCH has come a long way in a short time, and the team are really excited to continue to develop and improve the service through collaborating and educating families and patients and the healthcare community to improve the outcomes of children and young people living with sickle cell disease. Thank you very much.
Thank you, Anna. That was a great presentation. And as a carer of adult sickle cell children, we were diagnosed in Victoria and we now currently live here in Queensland. It's great to see the progress over time as my adult children are about to reach 30. So it's great to see that all of those processes have changed over time. I recall my younger children, when they were getting blood tests, for example, at 15 months old, they knew at the Royal Children's Hospital where the actual pathology clinic was, and they would run in the opposite direction whenever they saw. So it's great to see that you've got those processes in place. We do have a question here from Amy in Queensland, and she asks, hello, Anna, can I ask how you provide education to regional patients? Do you provide outreach clinics? Amy from Queensland.
Yeah, hi, Amy. So we don't actually have outreach clinics. We all do it. We do just sort of telehealth over from the hospital here in Melbourne. And so while we do have a few parts of the state that have a population of patients with sickle cell, we don't actually head out there. Maybe that's something that we could look towards down the track, but at the moment it's all sort of done remotely and engaging with the healthcare providers in these towns as well. So yeah, that's something that's definitely growing as we're seeing more of our patients do live outside the metropolitan area.
Thanks for that, Anna. Is there any other questions from any of the other participants in this group that would like a question answered? I'm just wondering how, as a parent and having children that are older, but in the younger days, do you provide like action plans like they would for, I guess, someone that has diabetes or someone that has asthma within school? How do you educate the educators of these children that live with sickle cell?
Yeah, so this is something that we've been working on and improving. So historically, before my role existed, the medical staff had sort of a general medical advice form about sickle cell disease, some of the complications and sort of what to do in the event of this happening. We've now worked with our teachers at the Education Institute at the hospital to develop an education plan. So that's to highlight the some learning difficulties that may start to appear and how we can tackle those. But we also have an updated, I guess, action plan or general medical advice just about, what sickle cell disease is, a bit of a background, so educating that way, some of the common complications and what to do if they occur, and then also really promoting or creating an awareness of the really serious complications, so chest crisis and stroke and severe pain and what to do, and making schools to feel empowered to call an ambulance, that some of these complications are medical emergencies, and to really know that it is important to seek help early. And I think something that I would really like to do, and that other departments in sort of other specialties within the haematology department. So the haemophilia team do an annual teachers seminar, so reaching out to lots of schools around the state. That has previously been done in person, but this year it was done remotely. So I think that's a really good way, sort of having a webinar where lots of educators can ask questions and learn about sickle cell disease.
That's absolutely fantastic to hear that that's actually going on. I do feel with the increasing population of those families that live with sickle cell, that education is out there, so that teachers don't feel afraid of when they see something there that they currently don't know very much about. I do have another question from Karen. What are the current sickle cell numbers of children in Australia? Are you aware of the numbers currently?
Well, sort of around Australia, I'm not sure. I know in Sydney and Queensland and Adelaide and Perth that we have numbers. Maybe Sydney's population, 80, if you're there, you might be able to type in your numbers, but I know our population has certainly grown in Victoria. Now we're at 60. I think at Monash Medical Centre, which is also in Melbourne, they have another 30 children and young people with sickle cell disease. So with more patients signing on to the haemoglobinopathy registry, we'll have these more accurate data and numbers and figures. But yeah, Karen, I'm not sure. 80's commented there, so there's approximately 80 that are treated up in Sydney. So certainly numbers are increasing around Australia.
Okay, I guess we need to round up so we can go on to the next session. I thank you very much, Anna, for presenting at our very first Australian Sickle Cell Conference. And I hope that I'm actually quite confident that we're going places here in creating awareness of sickle cell here in Australia and helping those families and those patients a lot more with all the information that we're getting. So thank you, everybody.
Thank you.
Okay.